Good afternoon, and welcome to Wello's Returning Safely to the Workplace webinar. My name is Maria Prairie. I'm the Chief Operating Officer at Wello, and today joining me is a face that many of you see, Dr. Wendy Smeltzer. And we're going to talk about some of the best practices related to returning safely to the workplace. I'll start with some of the things that we're seeing in industry and certainly in the general public consensus around feelings of going back to the physical workplace. And then Dr. Smeltzer is going to jump in. She's going to talk through, from a medical point of view, the returning to the physical workspace and what that means. She's also going to give us an update, as she usually does through these webinars, on the COVID-19 situation and what we're seeing, what we're hearing, so that you can take that into account as you start to plan and continue to plan and bring people back into your physical workspaces. So there are some things that we'd like to make sure that you get out of our webinar discussion today. The first one is what we see and what we're hearing in terms of the effect of COVID-19 on employees. As we chatted about, we're going to do a medical update. Then we're going to talk through some business considerations as you bring people back physically. Certainly some of these you may have seen before, but we'll go over them very briefly. And then I want to talk through our return to workplace, so the physical workplace philosophy, and some of the questions that we've had from customers and what we've done as a result of that, and what the characteristics and the key components of that program are. So here's the deal. There's been a significant effect of the pandemic that are specific to the employees, to the individuals that are affected, but as well related to going back into the workplace in this reopening. Across the country, we have different stages of reopening. I'm here in Toronto. We haven't even moved to what we call stage 3 yet, while much of Ontario has moved. And for example, in Alberta, we're seeing that we're almost now completely reopened with some modifications, but having some effects of that. And so there's a tremendous effect on individuals. And what we know is that about 49% of Canadians report that due to the pandemic, they've had negative effects on their physical health. It's even higher with mental health concerns. And so about 60% of Canadians say that they're having issues mentally as a result of the COVID-19. And as we look at bringing people back into the physical workplace, PwC did a study recently of about 1,000 individuals, and over 70% had major concerns about going back into the physical workplace. And 51% said that their biggest fear was that they would get sick as a result of going back into the workplace. And so as we look at this, there's some other things that we need to take into account. About 54% of working Canadians have a chronic illness. We know that there are some factors. Sean, would you mind? Oh, sorry, you did it already. We know that there are some factors that make individuals a little bit higher risk in some cases. And chronic illness is one of those factors. The second is age. And 69% of Canadian employees are older than 55. So two significant risk categories across the majority of the employees that go into a workplace. And as we had chatted with before, we do know that individuals are reporting a higher degree of mental concerns and mental health issues. We do anticipate, as people come back into the work environment, that these will continue to grow. And certainly at Wello, we have seen not only an uptick in the number of people calling us with concerns about mental health, but we've also seen an uptick in the severity of those cases. And that is something that is not only concerning, but really demands as an employer that you take this into consideration as you're bringing people back into the work environment. And so, other studies show, next slide please, that only about 25% of employees feel that they're ready to go back into their regular work schedule, including going back into the office and commuting and all of those things that are demanded when a person's going into the physical workspace. About 75% felt that they would prefer to work from home more often, or only go into work when needed. And certainly, if you look at the news today, when Google announced that they are not going to bring anybody back into the physical workplace for at least a year, unless someone says, I'd like to come back. And so we're starting to see organizations make decisions like that, but not every work environment enables people not to come physically back in. And so when we look at, industries such as oil and gas or mining or retail, or banking, these are roles that actually require people to be in their physical setting. They can't be done remotely. You can't be a bank teller if you don't physically sit at your booth in your local branch. And so, it is really important that we make sure as employers that we have the right protocols and equipment in place to make your employees not only be safe, but to reassure them that you have taken every step and are making sure that they continue to be safe to the best of your ability. So what are those other things that we could be doing? I'm going to hand off to Dr. Smeltzer here so that she can give us our medical update. So Wendy, are you there?
I think I'm there.
Fabulous.
There we go. Well, I've got audio anyway. I can't seem to get video, but I'll let, there we go. Sean can help us with it. We're in. Anyhow, thanks, Maria. So as Maria mentioned, I'm going to really focus a little bit on the medical update of where we are right now in Canada, really regarding the virus, regarding the disease, testing, the vaccine, and how this medical information really shapes our decision and our actions as we move into this reopening of our businesses. And then we'll go back and look at some very specific things with Maria to some business items as we reopen. So as you're aware, we're now into this stage of reopening in many places in Canada and many places in the world. But I think it's important that we have an understanding of what measures we need to still really consider as we enter these stages, particularly in our business. One thing that's really important to understand is that despite the relaxation of some of these public restrictions, the virus is still here and it's going to be with us for a long time ahead. We've now surpassed the milestone of 16 million cases worldwide, documented cases. We know the actual number of cases is probably much more than that. And we've had over 650,000 deaths. The pandemic is continuing to escalate worldwide, and there are really rapidly rising numbers still in many countries. And if you look at that worldwide curve, it's trending upward. It really hasn't flattened. But we've been very, very fortunate in Canada because we did achieve a flattening of our curve quite early. And some provinces have flattened a little more than others, and some a little more quickly than others. And unfortunately, some are starting to trend a little bit upwards again and lose some of that flattening effect that they had. And what this means is that initially in Canada, we controlled that surge of infections. And this was due to the public health restrictions we put in place quite quickly. And why that's important is we know that 20% of infections are more severe and generally require hospital care. So when we reduce this large surge, it reduces the number of people requiring hospitalization. And that really, the goal of that restriction or flattening is to ensure that we have enough hospital beds, enough ventilators, and enough medical care for those people that require that level of care. And in addition, we need to keep hospital beds and ICU beds available for those other illnesses that continue to require them, such as strokes and heart attacks and all those other things that do continue despite COVID. And this is really unlike a lot of other countries in the world. And we saw that early on in some of the European countries where there were such large surges that the medical system and resources were just overwhelmed. But flattening the curve here does not mean the infection's over. We will continue to see new cases and the virus will continue to spread. But our goal is to have our medical system be able to handle this. And as long as we keep that curve flattened, we can handle the numbers in that top 20%. But in the past few weeks, since moving into some stages of reopening, we've been seeing a bit of an uptick in numbers of infections in some areas, and the curve not as flat as in the past. So we do need to really consider it carefully and do those preventive measures to get back to that flattened area. So what do we know about the virus and the disease? It's a new virus. It's only been around the last 7 months, so we're still learning, and that information is evolving. What we do know, that the virus is actually called SARS-CoV-2. The disease is COVID-19, which stands for coronavirus 2019. It hasn't changed. It's in that coronavirus family, same as a common cold, in a little subgroup. But what we do know now is that we've identified 2 variants of this virus. The outer, those spiky proteins that stick out, we know that there have been variations or changes in the protein on that spike part of the virus. But what we don't know yet is the clinical implications of those 2 variants. Does it translate into regional differences or virulence or the outcome? So these things are still being under study. We also, it's quite interesting now because in Canada, some jurisdictions are now going back to stored respiratory samples from hospitals and labs and analyzing them now to see, could this virus have even been present before it was identified in Wuhan and really became a pandemic? So there's lots of information still that we don't know and that we're still studying. We initially thought this virus really only spread through travel, through infected areas. We now know it's community transmission, which is that person-to-person transmission. We know it's a respiratory virus, but now we're starting to detect virus in non-respiratory specimens, such as stool samples, blood samples, ocular samples, and other fluids. But there's no proven transmission through those measures and no transmission through abraded skin. So by touching the virus, you don't absorb it. We know that we thought it was transmitted only from people that had symptoms, but now we know it can transmit up to 2 to 3 days before people get symptoms, what we call pre-symptomatic transmission. And even people without symptoms or very, very minimal symptoms can be infectious and spread the virus. We initially thought it was just flu-like symptoms, those sore throat, fever, cough, etc. But now we know there are other symptoms that are attributed to COVID, such as GI symptoms, nausea, vomiting, diarrhea. Loss of taste and smell seems to be common in COVID. Muscle and joint aches, headache, extreme fatigue, and even pink eye. So we now know there are many other expressions of that viral infection. Initially, early on, the main number of infections were occurring in the older population, but it's now shifted to the younger adults. And actually in Canada last week, the last reported week, which was July 15th to 22nd, 63% of new COVID cases were actually under the age of 39 years. But what's of particular concern is 31%, or almost a third of those, ended up being hospitalized, so more significant infection. We also now are learning that children who get the disease tend to get milder disease, and those children under 10 years of age may be less infectious. But we're also seeing a multi-system, sort of an inflammatory syndrome develop in children that may be related to COVID weeks after infection. What we do know is the importance of testing for that presence of virus. So testing is really, really important to get a handle on the spread, along with tracing contacts once you've identified the virus, so you can isolate those contacts and then test them and so on. And in Canada, all our testing initially was done, and the majority is still being done through our public health agency and analyzed in provincial labs through something we call PCR testing, which is viral RNA testing. But some provinces now are looking at having even pharmacies involved in testing to add to the public health screening centers. And there are some labs now starting to offer private testing, and they report into the public health agency so that they can continue to track all positives identified. But there are some challenges with testing. The ability of the test to show positive results depends on the viral load, which is present. And that can vary through the course of infection. So you can get false negatives if you test at a point where the person is not shedding sufficient virus at that time, or the site of specimen collection just doesn't have enough virus present, especially in that early incubation period. So then you can be falsely reassured that it's negative when perhaps it isn't. Also, we can get lingering positive test results because viral particles can stay present for a long period of time. There are some reports of up to 6 weeks after infection that the viral particles can still be detected on testing, but the virus may no longer be infectious at that time. So even with our gold standard PCR testing, the results aren't perfect. So what we're all hoping for is that one day we'll have that really easy point of care test system that we can have on site in our workspace and just test quickly for the presence or absence of virus. And there are a number under development right now. One was actually approved and released in Canada in mid-April. It was called the Spartan Cube. And it was a little small DNA analyzer, so you didn't have to send the sample off to a lab and wait days for results. You could do it right then and there. And in about an hour, a test result would appear. However, very shortly after its release, they found that that proprietary swab just wasn't picking up enough material to give reliable results. So unfortunately, it's been withdrawn, and we're awaiting modification and hopefully a re-release. So that is one possibility of getting point of care tests down the road. And this was initially just really sold to government agencies to try and help remote hospitals and places where sending samples to labs wasn't feasible. But they did commit that they would eventually bring it out to businesses and retail settings. There's another point of care test that's been approved by Health Canada, but not yet available in Canada. And there's been a well-known one in the US, the Abbott ID, that is also approved and not yet here in Canada. But again, some variability and reliabilities, especially with the ability to reliably agree with positive results. But Health Canada is committed to expediting the approval of reliable technologies as they develop. We also know about this virus. There's no specific approved treatment or cure for COVID-19 at this time. There are many drug trials underway, and one of them, remdesivir, that you probably heard about on the news, is approved for use in very ill patients to reduce the duration of the viral infection, more in a hospital setting. It's still under a clinical trial, meaning it's under study, but it is starting to be used a little more readily. There are many other drugs that are about 40 drugs, clinical trials underway in Canada, in centers across Canada right now, looking at other antiviral drugs, some that are used for HIV, immunomodulator drugs, even that old BCG, which was the old TB immunization, is being looked at, nitric oxide. So there's a lot of things under study, but we don't have a specific treatment yet at this time. So without having a good treatment, the major focus has been to try and develop a vaccine. And that is to help prevent the spread by building immunity. And vaccines are under development in many countries around the world. And again, our Health Canada has committed, if you look at their website, they've got lots of statements that they are committed to expediting the approval of vaccines once they're present. But it's a longer process than for drug testing. The drugs in trials that are being tested are already approved for other uses. It's just a new use that is being tested. But vaccines, it's a new product, and they first need to go through testing for safety and then for efficacy or how well it protects. So vaccines are not quick. We've seen estimates for timing of having a vaccine available anywhere ranging from 4 to 6 months to 2 or more years before full availability. But there are a number of developers worldwide that are starting to progress to human clinical trials. And there are 2 that are kind of pulling ahead of the others right now. And that's the vaccine developed at Oxford University. They've partnered with AstraZeneca. And then there's one by the NIH, the National Institute of Health in the US, and they've partnered with Moderna. And they've been given billions of dollars in funding, to try and move this forward. But both of those have now completed their phase 2 trials with humans. That's giving a vaccine to over 1,000 patients. And the results are looking promising for safety and the ability to even have an immune response at a month. But remember, these are still under study. We don't have 6 months of data yet. But they're going to be moving into what we call phase 3 trials soon, which would be up to 30,000 people, and really try to follow that antibody response and the immune results from it. And interestingly, the AstraZeneca vaccine, they've actually they're moving now into early production, so that as they're developing it, they're producing it and taking a chance because they want to expedite the availability once they do get approval. So without a vaccine right now to give protection, the only other way we can develop immunity is natural immunity by having the infection itself. But there are many unknowns still about our own antibodies in this virus. So we know, our immune system works to produce antibodies or proteins into the blood once you're exposed to something that's foreign. And the first antibody response is just within a couple of days after exposure, but those are more general antibodies called IgM antibodies. But the ones that we're really interested in is these more specific IgG antibodies, which are measured at around the 2-week mark after infection. And these antibodies, these IgG antibodies, often do give immunity or protection when you're reinfected with that same substance, but not all antibodies do. And some may give protection, but it may be very transient, and others may give protection that can be long-lasting. So antibodies tell us really, has there been exposure, but it doesn't necessarily mean that you are immune to it. So these factors are now vigorously being studied for COVID-19. And there have been 2 preliminary studies that have come out so far, suggesting that the antibodies produced may actually fade quite quickly. There was a study released just last week in the New England Journal of Medicine that said by 36 days, the antibody levels had dropped by half. So antibody levels are under look. And we also know that the level of antibody may not be the only thing to consider, because sometimes you have we have something called a memory response, an amnestic response, that once you're re-exposed, even if your antibodies aren't there, you may make them more quickly. So there's still a lot to be learned from this. And only once we have more information will we know whether that antibody testing will give information about who's protected and who not. And that's that whole idea, concept of an immunity passport. So we really need more information before we can make those declarations. But there is an antibody test approved in Canada now. And this testing has been committed and approved by public health to be doing some studies over the next 2 years. And it's already started in some provinces, and some private lab companies are also able to access this testing and hope to be offering it soon. And the goal is to really study the community exposure over a 2-year period to see how these antibody levels change, and then to monitor as waves of infection reappear to see if there is that protective effect to prevent reinfection. So it's interesting now, we're actually, there's been one little study released just very recently through the Canadian Blood Services. What they did is they took all samples in Canada collected for blood donation through the Canadian Blood Services for a month. That was May 9th to June 8th. And that was right after the virus peaked in Canada. So they thought that was a good time to check for antibody levels in just these blood samples donated. And they found that less than 1% of those samples had antibodies, meaning that 99% of the people tested just through these blood donation samples, random community samples, had not been exposed then to COVID. So if we look at our numbers now, we have about 115,000 total confirmed cases in Canada. And with our population of about 37.7 million, we only have about 0.3% of our population known to be infected with COVID, which means 99.7% would still not have immunity from disease. They have not been exposed. And that sort of goes along with that study with the blood services saying there's less than 1% antibodies or protection in the community. So we're really a long way off from herd immunity. So to give general population protection, which is that concept of herd immunity, you need a large percent of the population immune. And then that slows the spread by breaking that chain of transmission. But you need to get approximately 70% of the population immune to achieve this. And we're nowhere near that right now. So this is why there is concern and talk about a second wave of infection. So really, without a vaccine, without an effective treatment, and without herd immunity, the best prevention is our public health measures. So if we look at the first one, social distancing, that 2-meter requirement, the virus is transmitted in respiratory droplets. It's a heavy virus, and it drops out of the air in those droplets in less than 2 meters. Which is why that distancing is recommended. If you remain 2 meters from someone infected with COVID, you won't breathe in their respiratory droplets with just normal talking. It changes with exertion, singing, shouting, etc. Now, there are some countries that have started to shorten that distance, changing it to 1.5 or 1 meter. And that is really more a trade-off to get compliance rather than based on science. So 1 meter is better than no meters, but 2 meters is our evidence-based protection. There are some new studies coming out suggesting there might be transmission through an airborne route, what we call aerosolization, through particles that are smaller than droplets that can be remain in the air and travel a little more distance. But this is controversial right now. It's not determined whether this can occur spontaneously. It does occur in some medical and dental settings when there are procedures that cause this to happen. So different precautions are required in those settings, but we don't have confirmation yet that that is with the general public. So we're still working with our 2 meter social distancing. Now, if you can't maintain that 2 meter distance, the advice now is to wear a mask. And that is a formal recommendation from our chief medical officer. And we're seeing many jurisdictions now across Canada where mandatory masking is now in place in public spaces such as airplanes, public transit, public indoor spaces. And these are areas where you can get higher congregations of people and cannot ensure that you're maintaining that 2 meter distance. So masking is now required there. But it's important to know with masks that masks prevent you from spreading your droplets to others. So when you wear a mask, you're actually protecting those people around you. So that's why you want to see those around you wearing masks, because that's what will protect you. Another public health advisory that we all have to consider, especially in our business settings, is stay home if you're sick. If you have symptoms, you are definitely carrying viral load and you don't want to spread those germs to others. Even if you're wearing masks, etc., it's prudent and it's in public health interest to stay home if you're ill. Hand hygiene, I think everybody's tired of hearing about this, but it is so important. Hand hygiene and not touching your face will protect you. We know droplets in this virus will land on surfaces and it can live, there are varying reports on different surfaces how long this virus can live, but it can live up to a few days on these hard surfaces. Our hands then can touch these surfaces, pick up and become contaminated. And if we then touch our noses, the mucous membranes through our nose, mouth, and eyes can absorb those particles, and then we can become infected ourselves if we touch our faces once our hands are contaminated. So hand hygiene is one of the mainstays. And we know that washing hands doesn't just physically remove the virus, it actually, the soaps will break down that outer coating of the virus and kill it. And if you can't wash, hand sanitizer to help destroy those viral particles. So this is why those public health advisories are so important. We're fortunate in Canada, we have a wonderful public health system. And although we have a chief medical officer, a public health officer for Canada, one of the challenges we have is that our public health systems operate provincially. So we do see some differences, both in some of the advisories, not those basic ones, those are common to all, but in some of the regulations that are coming about, and some of the stages as they open will be varied by province. One of the things that we see is just even testing. The numbers and the criteria for testing can vary, and that does make it hard to compare numbers really from province to province because those testing criteria are not necessarily the same. Contact tracing has always been provincial through public health calling, but some provinces now are putting in place a contact tracing app, and the federal government is soon to launch a national contact tracing app, but it will need significant uptake by the Canadian population in order to be effective. As I mentioned, there are a few that are in provincial already, and those provinces are actually in discussion with the national one because it's important to have them connected in order to do effective contact tracing nationally. And a lot of questions about those. I know a lot of people are fearful of privacy concerns, but how they work is not through locators, but through Bluetooth. So if you have that app on your phone, it will actually send out a beacon and it will register contact with other beacons with other phones that have the app. And only if you're a specified distance, so they're looking obviously within that 2 meters, and for a specified period of time, which I understand is about 15 minutes, then it will register with those 2 beacons. So then if somebody does test positive who uses the app, their phone can actually register all the other phone beacons that were in contact under those parameters and advise the people who own those phones that they have been in contact with COVID, so they can then be isolated and tested. So as I mentioned, it's Bluetooth. It doesn't have locators or geotagging on it, but there are still many that are concerned about privacy And so we're not sure what the uptake will be, but we know it would certainly help contact tracing. And we also see in our different provinces, different stages of reopening, just because the infection curve was different in different provinces, depending on that, when the virus arrived there and the measures that were put in place in those regions. So this is resulting in some different stages for reopening, as we've seen. But the principles for reopening businesses are consistent in every province and every territory. It's going to be gradual, it's going to be in stages, and until we're in that final fully open stages, we will need to uphold those public measures I've talked about just now. So I look at, there's sort of 5 basic principles medically that we need to really consider in every action we take as we're opening our workplace. And the first principle is we need to keep employees out of the workplace who are sick or who are at risk of COVID through exposure, travel, etc. So this can be accomplished through screening of employees, and that can be done through various methods, you know, whether it's an on-site questionnaire, whether it's with temperature checks, whether it's digital tools such as our Wello screening tool. But we need to do something to ensure that we're not bringing people at risk or who are ill into the workplace. The second principle we need to do is really try to keep people home as much as possible, which means having people work virtually whenever that's possible. And as Maria mentioned earlier, there are some businesses that it's not possible, but if it is possible, that's a consideration to look at. The third principle, every business will need to ensure that physical distancing of 2 meters is present for their employees and clients, and have their employees wear masks if it's not possible. Fourth principle, businesses really need to look at not just cleaning practices, but also providing resources for hand hygiene and enhanced cleaning. So hand washing stations, having hand sanitizers available for employees, especially in communal areas, if you've got a common printer station or lunchrooms, etc., where different people can be handling and touching equipment. Enhanced cleaning of that facility and those pieces of equipment is vital, as well as providing hand sanitizer. And the fifth principle is businesses really will need to uphold regional public health advisories on the restrictions in their jurisdiction for travel and size limitations. So we know with travel, some provinces you have to isolate even if you've just been out of province. So you could not come into that workplace for 2 weeks after leaving your province, or certain jurisdictions even within provinces. And we know that that can vary province to province. So businesses will need to look at that factor, as well as looking at the number that can gather together. That will affect size limitations for those in-person gatherings that can vary province to province. And that affects numbers that you can have for meetings or get-togethers in your workplace. And you must still accommodate that physical distancing requirement as well. So this is going to keep virtual meetings and webinars such as this in play for a long time, and really will affect business travel as well. But what we do know as well, in following those principles, all provinces are going to continue to monitor results as they go along, as these restrictions are gradually lifted from one stage to the next. And they're monitoring not just the number of cases that appear, but they're also looking at utilization, for example, hospital beds, ICU beds, etc. And if we're not successful and we see things really rising again, there is a risk of tightening up those public health restrictions again. So that's why, as we enter the stages of reopening and opening our business again, it's really important to let those public health medical principles guide our decision-making, because we are establishing a new way of conducting our business, and this will be our new normal for the foreseeable future. But as I said, it's still a new virus. We're only 7 months into this. We're still learning, and we may find recommendations evolve and change over the next few months as we learn more information and see the results of these early stages of reopening. So I hope this has been helpful. I really just wanted to impart that information so people could have an understanding and try to apply those principles as you're making decisions for reopening your businesses safely. So I'm going to turn it back over to Maria, who's going to talk about some very specific issues to consider as we reopen. And then hopefully we'll have time. I see some questions coming in, so we'd love to have time to answer your questions. So over to you, Maria.
Absolutely. Thank you, Wendy, for such a thorough overview of an update on what's happening. Things seem to change so rapidly, sometimes even overnight or within 30 minutes. And it's always hard, I think. I heard the term today, COVID noise. And how do you push away the noise and get down to the facts? So thank you so much for helping us with that. I'm going to wrap up really just talking through some of the best practices as we bring people back into the workplace, and really to build on, you know, your wisdom, Wendy, with respect to those 5 basic principles in bringing people back safely. And I'm sure that most of our audience have seen these, so I'm not going to spend lots of time on them. Certainly we can answer any questions related to it. But, you know, how do we make sure that we minimize that risk? Now, I'm going to talk a little bit about the philosophy that we've used and the reason that we, you know, move forward with developing a service around helping people come back safely. But there's some main and important things to do, right? So having the self-assessment tools in place, making sure that you understand that people are safe to come back. Having common space protocols. So, you know, you speak about this 2-meter distance. I know that in previous webinars where we talked about this topic, people were very, very concerned about, can we host meetings? How do we do that? And certainly what we've seen and what we've been doing in our own work environment, because we do have an essential service healthcare clinic in Calgary, and so we have been open, is that we're actually not having in-person meetings. Even though we may be in the same physical office environment, we're still doing Zoom meetings and the such, so that we can minimize risk of being in a room with other individuals. Communication is exceptionally paramount. Like, it is absolutely critical in helping people understand not only what you are doing as an organization to keep them safe, but as well, you know, keeping that communication lines open. There are many folks who don't necessarily want to disclose that they are high risk for some particular reason. There are others who may be taking care of an elder parent or a child who is at a higher risk. And so keeping communication, two-way communication open, really helps to enable them to feel comfortable coming and speaking to you as an employer about some of the challenges that they may be dealing with themselves and things that increase their stress levels and mental health impact. It is also really important that you have your policies in order. You know, certainly we have been working with companies as they have brought people back into the physical space. And one of the most important parts of that is to make sure that you've defined the what if. You know, what if somebody is ill and they can't come to work? What does that mean? Does short-term disability kick in, and when does it kick in? If it's travel related, was it business travel? And so having your policies and procedures very clearly documented, very clearly communicated, and available to your team is very, very important as you start to bring them back. New slide, please, Sean. And so, you know, as we move through these, sorry, Sean, can I get you to change slide for me? There we go. So as we move through the things that we looked at as we brought our teams and kept our teams working, we had a number of clients that came to us and just asked for advice. And you know, you get a little bit of the Dr. Wendy wisdom, but we have many clients that call her regularly just to ask what they should do. And, you know, things like, how do I bring contractors? I have policies in place for my own team, but we have, you know, contractors that come to our sites every day. How do we deal with that? And how do we deal with it if somebody is sick? What should we do? How do we put things in place so that we can minimize the risk of COVID coming into the workplace? And so our philosophy has been really based around a few pillars, which certainly Wendy did allude to and speak of. You know, surveying people before they come into the workplace. Are they eligible to come into the workplace? And if they're not, what happens? And so based on, you know, the questions that we had gotten, we actually developed a tool Certainly, my purpose and intent in discussing this is not to sell you, but to have you understand the key pieces of it. So as you look at developing a process for your own organizations, what are those things that you should consider? So in this particular case, we have a screening tool. It's done prior to the employee coming into the workplace. If they arrive at the workplace having not done it before they can enter, they have to complete it. And there are 3 basic questions. Do you have symptoms? Have you been exposed to somebody who has COVID or is suspected of having COVID or potentially has symptoms of having COVID? Or have you traveled? And the rules around each of those questions are different by province and by territory. Certainly we see that in the Atlantic provinces where now they have the Atlantic bubble. But it's important that if you're traveling, if you're going to work in Newfoundland as an example, and you have traveled from Nova Scotia, that's okay. But if you've traveled from Ontario to go to Newfoundland to go to work, you actually have to self-isolate for 2 weeks before you can go physically back into the work environment. And then we also have to take into consideration things like anyone who may be exempt. So there are certainly some roles, truck drivers, some industries as well, where you may have an exemption according to the provincial health guidelines. And so you need to take that into consideration. And then for those that are not eligible to go to work, what next? It's important that whatever screening that you do, that there is some guidance for the employee as to what they should do next. So, certainly it's always paramount that they connect in and complete the self-assessment tool for public health in each province and territory, for their province and territory, and that they then follow up based on the guidelines there. On the Wello side, we have a team of people who support individuals who have questions about that. It can be an incredibly complex, scary next step. And so we do have a team of people who can help and support with that. And then what happens if they're sick? So if an individual is sick, if they're very sick, they need to be calling 911 or going to an emergency room. But if they're not emergent, as we would say, then how do they get better? How do they determine, if it's an ear infection or if potentially they have symptoms of COVID? And so, the guideline very much is to speak with a medical clinician. On the Wello side, we have clinicians, so our members will connect in with Wello, or they'll go to see their family physician. And, I think the most important thing here is that as an employer that you do some tracking. And so you want to understand if there are any particular trends. So let's say that you've got 6 locations in 4 provinces. And one of those locations, all of a sudden, you start to see an uptick of people not being eligible to go to work. What does that mean? Does that mean potentially that you have an exposure there that you didn't know about? And so looking at trends is really important from a public health safety point of view, but it's also really important from a planning perspective. And I run operations. Even in a virtual setting, we will have people who will be ill and so they can't work that day. Knowing that, 5% of your employees on average at a particular location are not physically eligible to come back into the workplace enables you to make sure that you overstaff by that 5% if you need to, so that you're not left at risk of not having enough people at the office on that particular day. So our philosophy very much is to make sure that we mitigate and minimize the risk of bringing COVID into the workplace and to provide an easy, safe, private and secure mechanism for individuals to be honest in answering and to enable them to make sure that they have those next time steps that are clearly outlined. Our goal here is to minimize mental health concerns, minimize risk related to returning back to the physical workplace. And certainly what we have seen from our customers that have implemented our tool, or in some cases, we do have clients that, in oil were not able to stop production, so they implemented their own processes and tools, and people feel more comfortable going back knowing that their employer is putting all of these important things in place to keep them safe. So We've got about 17, 18 minutes left. Let's spend a few minutes going through and answering your questions.
Great. Well, thanks, Maria. I'm looking here and there have been a number of questions that come in. So first one I'm going to throw over to you. How do I conduct safely in-person client meetings?
So, you know, it's all about where the physical space is. And I'm sure that many of you have been trying to socialize and get a little bit of social time in by being outdoors. Certainly that is one way, is if you can be outdoors with your client. I wouldn't necessarily recommend being in the same physical space unless you have a very, very large indoor space. But we have been using Zoom meetings. And we've been using, certainly I've been on Skype meetings and WebEx meetings, and they actually, over time, you get really far more comfortable in doing them through that environment, and they get much easier. So, you know, consider what are those digital options. If a digital option is not possible, can you meet in an outdoor space? If you can't, making sure your indoor space is large enough. And I would also say take those precautions around hand washing, asking questions before you get together, about whether or not you're feeling ill or you may have had an exposure or traveled, and wearing a mask. It really is just making sure we've done everything we can.
Yeah, it really comes down to those basic principles, whether we're meeting socially or in a meeting setting and work. There are a couple of questions here about masks, so I will take those on and answer a few of those questions. One is about somebody who has a medical condition that prevents them from wearing masks. And there are certain medical conditions that are exempt from wearing masks. However, as you know, you want to be sure that you're free of infection if you go anywhere, because the mask is not really protecting you, it's protecting those around you. So if you have a medical condition that precludes you from wearing a mask, I would say you're a little more vulnerable, and you want to be ensured that those around you are wearing masks. Again, getting back to that physical distancing, so that you are less at risk of breathing in those droplet particles from somebody else who might be carrying the virus, so staying 2 meters minimum apart. There is some evidence to suggest that if you're in an outdoor setting with lots of fresh air circulating, not a strong wind, because that could blow and bring virus towards you, but in a general outdoor setting, that is often a safer place to meet if you're not able to wear a mask. But again, you want to preserve that physical distancing. And then the last part is to really be sure, if you're not wearing a mask, that you are not handling your face, not touching that nose, mouth, or eye region, and making sure your hands are washed or sanitized so that you cannot bring that virus into you. So it's, again, those same principles, but just really stringent for yourself if you're not able to wear a mask. Another question here about mask. If you're using a homemade mask or a cloth mask, how often can you use it? And sadly, that is one time until washing. So if you are going to the grocery store and you put your mask on, wear it while you're out. When you come home and you change it, it is not then to be picked up and used again. What you have to think of a mask as is it's almost like a little filtration system. And that filtration system is keeping the virus particles that are coming towards you on the surface of the mask and your viral particles or breath droplets on the inside. So that mask part should be considered contaminated. So once you have worn that, you want to put it into a sealed bag or a sealed laundry bag and then wash it before you use it again. If you need to go out again, you should have another supply of cloth masks that you can rotate them. Or if you're using a disposable mask, obviously you dispose of it and apply a new one. The important thing with using a mask is to always have your hands clean, so there's no risk of viral particles on your hand when you're applying the mask. And then when you remove it from the earlobes coming out rather than touching the surface. Dispose of it and then hand sanitize because you have been exposed by touching that mask surface. So using masks, donning and doffing them, as we call them, putting them on, taking them off, is really critical that your hands are clean putting them on, and that you clean your hands after taking them off, and that your mask is clean each time you remove it, and then reapply either a new, fresh, laundered, washed cloth mask or a disposable mask. If you are doing something for a long period of time and your mask is on, if it becomes very damp and you've worn it for many, many hours and it's quite damp, then that would be a time to remove it and change it for a fresh mask as well. So another question I'm going to look at here. Here's one coming through. Oh, just a clarification on herd immunity. It is actually 70%. Now there are some that say perhaps 60 to 70%, but the general consensus is around 70% of the population to give herd immunity. So that's why we have to really look that nobody generally is protected right now from herd immunity. With that less than 1% in random blood samples and looking at antibody testing for the people who've had it, we have under 1%. So really 99% of our population is not immune, and it will really take a vaccine to get us to that level. So that's the question on herd immunity. Another one, and you alluded a bit to this, Maria, but maybe a little more specifics. How can we help our team members overcome the anxiety when they finally return to work and then they're sent home again for a second wave?
You know, there is a lot of discussion right now about a second wave, and certainly what we are seeing and what we're hearing from customers is worry specifically around what happens if we need to go out again. And, you know, from our point of view, and certainly this is what we have done internally as well, is putting the right things in place today to keep people safe and communicating what you think you will do if this were to happen again goes a long way in managing anxiety levels. You know, even if the news is difficult, it's easier, at least people will know. And so certainly with our internal team, we have an office in Toronto we've decided that we won't go back to until at least the beginning of January. That took the stress level of our team down quite significantly in Toronto because now they could relax, know they were not physically going back into the office. Similarly, and Wendy, you can attest to this, when we put the very stringent things in place to mitigate risk of COVID coming into our clinic, and it just helped our team feel more comfortable as they come to work, that we had done everything we could to keep them as safe as possible. Super important, certainly in a healthcare environment, but the same principles apply in the regular office environment. And so I would say, you know, make some decisions early, communicate those decisions, put things in place to make people feel more comfortable that you're keeping their safety at a high concern, and put mechanisms in place for those who may be dealing with a chronic illness that puts them at a higher risk, or supporting and caring for others that may be at a higher risk, so that people can come safely and have that conversation with their people and culture team or their HR teams, and make sure that they understand what the outcomes of that may be from the policy and procedure perspective.
Excellent. And, you know, I think you touched on something there, Maria. I think just that openness of communication is so important in a workplace. You know, one thing I think we all have to remember and really understand of each other is that this is unknown waters for all of us. You know, we're moving into situations that we haven't dealt with before, and nobody has a very clear picture of exactly how things are going to progress over this next 6 months to a year. So all we can do is be open and honest that we will take steps as things unfold, and we will deal with them, you know, appropriately. But
Absolutely.
Nobody can make a guarantee of how that workplace. We may all get back and then find by the end of last quarter that we're back home again. These are things we don't know. So just, I think, responding and being open with your employees and your coworkers that these are different times. And we're all just going to do our very best to follow appropriate measures to keep everybody safe under whatever circumstance arises.
Well, and I think the other piece as well, Wendy, and certainly you and I have seen this, is acknowledgement. So different people are going to deal with this quite differently. And what may cause me a tremendous amount of stress may actually not cause you the same level of stress. And so as leaders, in organizations. We need to be open that some people may deal with things quite differently. And, you know, that's where our EFAP programs come into play. This is where benefits packages come into play, and encouraging people to use those, even though, you know, they may feel that they just have very high anxiety and it's very identified. Certainly in working with professionals may help to alleviate some of that stress.
Absolutely. There's a couple of questions here regarding children and transmission of virus, and I'm sure that's very topical for many employees whose children are looking at either going back to school or schools reopening in different jurisdictions. And this is fairly new information that's really, when we look at information, we have to get the data first, and we've only got a few months of data to really start analyzing. But it's pretty clear now in the data that's come forward over the last few months that's been analyzed and put out in the last few weeks, is that children do seem to be less at risk of getting the infection and also less at risk of transmitting the infection. And we don't have the exact knowledge of why that is, but it's under study. There are a couple of theories out there. One theory that was put out that I think has been pretty well disbelieved at this point in time is that children do tend to get more colds, and somebody asked, actually they mentioned even in a question here, they're more likely to have sneezing and coughing and runny noses and all of this. And we know that a lot of those are coronaviruses. Could there be some little bit of protection from those ongoing coronavirus infections they have? But that theory, they're not really thinking is a good one at this point, because even newborns who have not had these exposures may be able to get that virus as well. But one of the theories that is out there, and it's under study, is there is a certain little protein and a receptor that allows that virus to get into the lung cells. It's called an ACE receptor. And that may just not be mature in children at that age. Therefore, if they don't have the receptor that allows that virus to enter into lung cells, they may not get it as severely. And a third theory is that their immune systems are just not quite as well developed, you know, as an adult, and they're a little more flexible. They haven't really got that rigid immune system programming that we develop as adults. So there's no clear answer right now. We're just looking at the data that's coming in, and these are more observations that now will be studied to give us some answers. But it doesn't mean children are not at risk. I think we just heard there was even a recent death that has occurred from, you know, a young child with COVID infection. So it's not that they're not at risk. It's just they may be less at risk for severe disease and perhaps less able to transmit that virus to others. So that's sort of the thoughts that we have right now on children with coronavirus. Another question regarding vaccine, saying, you know, understanding that Canada is desperate to get a vaccine in place, are we being advised of the side effects of this virus as well, or pardon me, of this vaccine as well? And yes, we are. That's the purpose of the different phases of studies when we're starting to look at even testing this vaccine. The first thing they test for is safety. Before they even getting into testing whether or not it's going to work or not. There's no point in developing a vaccine that is effective, but it has a very high side effect or mortality risk of the vaccine itself. So the first thing they test for is safety and side effects, and have to ensure that the side effects obviously are tolerable and are less than the disease naturally would cause. So safety is the first part, and they do that with very small samples of people, 4 or 5 people at a time, that as we move into clinical studies, obviously they often start with animal studies first and then test that safety and then gradually increase it, because in a small sample size, you may not have enough people to manifest a lot of the side effects or significant side effects. So they start with smaller groups, and that's why now they're moving into those phase 3 studies with 30,000 people, because then we would start to see a true representation of side effects. So Health Canada looks at these things very carefully. They will not approve a vaccine that has not a good safety profile. So I think we can be reassured we have a system in place to protect us. So Maria, any final comments you'd like to share before we end our session?
Say that it's a very complex situation, right? It's often changing, it's fraught with stressors. It's all in the planning and communication. And, you know, I think about the work that we did on our end, and certainly Wendy, you and I meeting at least once, maybe twice a day. And now you're working with the clinical team as well as we open up more services on the clinical side in person in Calgary. It's all about planning, and it's all about communicating what we plan, and to make sure that you have some things in place related to safety so that individuals feel comfortable when they come back in. I think that's the most important things.
I agree. And I hope everyone today has will really embrace those public health advisories, not just in their businesses, but in their personal life. And it's going to help all of us in Canada as we move forward. So I'd like to thank everybody for attending today. And I just want to remind everybody, we share your positive thoughts in your workplace. And as you reopen to our #Wello community, we're trying to build a positive community there as our businesses reopen. And we wish everybody a safe and healthy rest of the summer.
Have a wonderful afternoon. Thanks so much for joining us today.
Bye-bye.
Bye.